Joining me now is Dr. Harvey Risch, professor of epidemiology at Yale School of Public Health, and Dr. Bhattacharya, Stanford University, epidemiology professor as well. Dr. Bhattacharya, why have we allowed the CDC to apparently have so much sway about the way we think about our lives and even think about our freedom?
Yeah, I saw a CNN headline that said that the CDC has given people vaccinated their freedom back. The CDC doesn't have that power. What the CDC should be doing is they should be giving good, scientifically based advice, and then trust people to make good judgments based on where they are in their life. For vaccinated people, that means you are immune. You're not it's very, very unlikely you're going to pass the disease on to anybody. Live your life freely. I think it's long past time that they gave that advice. I'm glad they finally stepped up to that.
And Dr. Risch, the big announcement today from the CDC was that if you're vaccinated, strike up the band, because then you can be with some other vaccinated people indoors, I guess one other family of vaccinated people, and you can take your masks off. And then you can maybe be with small children. And people are acting like, oh, thank you for giving us a little bit of our lives back. Dr. Risch, I'm not an immunologist, but it seems like a lot of people have forgotten basic immunology, who supposedly learned it in med school.
Well, the problem is that we've dichotomized everything. We've made everything black or white. So either the masks protect or they don't. Either the vaccines reduce transmission or they don't. And this kind of thinking has led to the closest approximation to truth, which isn't the truth, which is that the masks help maybe a little, the vaccines help a bit. Everything helps when you add it all up, but you can't make definitive statements. And so when the CDC makes definitive statements, it's just an approximation and it's not very accurate.
Now, with most adults who have not yet been vaccinated, Dr. Fauci is already talking about vaccinating children. Watch.
We project that high school students will very likely be able to be vaccinated by the fall term. Maybe not the very first day, but certainly in the early part of the fall for that fall educational term. Elementary school kids, they likely will be able to get vaccinated by the very first quarter of 2022.
Dr. Bhattacharya, why are we even talking about vaccinating a group that's extremely unlikely to get sick from COVID, die from COVID, and that we don't even have a lot of indication that have spread COVID to teachers or the adults around them?
Yeah, I think it's just a mistake. The vaccine trials themselves have not actually checked for whether they work in children at all. The vaccines work in children. The harm from infection from COVID to children is actually, I mean, more children died of the flu last year, even though the flu disappeared in the fall, than COVID. For children, the idea that they should be vaccinated sort of fails the basic test. Would you benefit a child by vaccinating them with COVID? No. I mean, I think the answer is on net, no. For someone who's older and vulnerable groups, absolutely, vaccines is a great idea. But for children, I don't understand why you would want to vaccinate children with this for a condition like this. Vaccinate children for measles, not rubella, absolutely. Vaccinate children for COVID, I don't see the argument.
Now, Dr. Risch, I hear this from parents all the time, and they watch this segment because this is what they're so interested in. You've both been so invaluable as time has gone on. They're really worried that their child is not going to be able to be enrolled in schools, public and private, if they don't get this vaccine. Do you see this coming conflict, and where do you see this playing out? How do you see this playing out, especially if kids were already exposed and had some type of exposure and obviously conferred some immunity that way as well?
Well, this is unconscionable. The state has no interest in vaccinating people that doesn't reduce the transmissibility very much, because the only interest in the state is protecting people who are unexposed, who get exposed to other people. If vaccination doesn't reduce that very much, then the state has no interest. It cannot mandate a behavior that's an experiment on humans that violates the Nuremberg Code in order to do experiments on people that have no interest for the state in the first place.
Dr. Bhattacharya, really quickly, we mentioned him before. Michael Osterholm is out with yet another dire prediction.
We still have a lot of high-risk people out there that when this surge comes, basically they're going to be highly vulnerable. The other thing we see right now is every governor wants to open schools. But the problem is, if you look at Europe, right now the challenge we're seeing is a lot of transmission in schools with this new variant. We're going to have some tough days ahead in the older population and in the younger population.
Dr. Bhattacharya, always Dr. Doom, 20 seconds.
I mean, I think you have to understand, we've already vaccinated something like 50 or 60% of people in many states, over 65. A lot of the people who are at risk of dying are actually vaccinated and not going to be dying. I think it's pessimism for its own sake and not likely to come true.
Dr. Doom, once again. Gentlemen, great to see you tonight. Thanks so much.
Pleasure.